When my son, who's now a sophomore in college, was 2, he had a protracted low-grade fever for 2 weeks with prominent adenopathy in the posterior auricular area and in the occiput. No other real clear symptoms. We took him in to be seen. The physician, a friend of mine, said this is likely viral and we'll keep an eye on it. I asked, as a nervous dad and physician might, if we could just get a CBC with some other laboratory basic tests. Of course, he came back anemic with lots of really immature neutrophils. I had an oncologist look at the slides and he thought there were blasts in the smear consistent with leukemia. And I remember the moment that he told me. It was like I was dropped into this echo chamber of things continuing to happen around me, but I was totally disconnected from what was being said. But I do remember my oncologist friend saying to me, I know this really great peds hemonc who is a real expert in reading smears. Her office is right down the hall, and I'll walk the slide down to her and we'll have her see your son. We didn't really sleep that night, terrified about the visit and the prospect of what lied ahead. The next day, we saw her and waited in the exam room, and she walks in, sits down, and says, I have reviewed the smear. Those are normal acute phase cells consistent with a viral illness. Your son does not have leukemia. We were relieved beyond words. The take-home here, a big part of our experience was a physician who we trusted saying, I know someone really good that I want you to see. The skill in this tip, as we transfer care clinician to clinician, being deliberate about positioning a colleague well can build notable confidence and help to relieve the worry and anxiety that patients have. So what do we say? We want to make it really simple. We have a fantastic group of surgeons. I'm going to have you see Dr. Remy for your inguinal hernia. This group is where I send my family, friends, and patients for their surgical care. Really expert, the best around, and patients absolutely love them. So what you say is up to you based upon the relationship that you have. Positioning colleagues well is really powerful and an incredibly simple way to create patient confidence. This works well for ED physicians to hospitalists, from primary care to specialty care, and for specialists to reference solid workups by their primary care colleagues. You try this challenge, try it and see how the patient responds. Share what techniques you use to create patients' confidence as patients transition from clinician to clinician. Let us know your story and your approach. We'll see you inside the next coaching tip on creating patient confidence.